My name is Ogechika Alozie, as many of you know, and just like you, I'm surviving uncertainty. It's been an amazing year as we go into year 3 of COVID, and I think we all need to pat ourselves on the back for surviving it. And we also have to remember the lives that we've lost. And whether it's been the nurses that have driven this community and helped our healthcare economy survive, whether it's been the fact that we put up tents in front of multiple of our hospitals, and like I've always said, those tents were not for camping. Whether it's the height of our pandemic in November of 2020, when we were using inmates to move bodies into mortuary vans, this community has been through a lot, but we've survived it. And at the same time, fortunately or unfortunately, I showed up on your TV screens a lot, whether it was Poppy Harlow, BBC, NPR, Shepard Smith, or locally, Saul Signs. You probably were tired of me talking about COVID. I got tired of me talking about COVID. But this conversation is not about me. This conversation specifically is about uncertainty and how we deal with it. I'm gonna ask you 2 questions. I just want you to park them. Question number 1, what is the biggest risk factor for hospitalization and death in COVID? Don't shout it out, talk to your friend, we'll talk about this later. Question number 2, what are the chances that somebody that develops SARS-CoV-2 or COVID pneumonia actually goes to the hospital? I'll be back. And so, as you can imagine, SARS-CoV-2 has elicited a lot of emotions as we've gone through these last 2+ years. And so I asked 100 people. I said, hey, tell me what you think about COVID in one word. And there's a host of things that they talked about: frustration, work from home, fear, death, anxiety. And when you kind of sum all of these things up together, what it really boils down to is uncertainty. And you may say, well, why uncertainty? Well, have you looked at the news? Everywhere you go since early 2020, it's COVID this, COVID that, a word that some have called COVID porn, and potentially appropriately. We talked about deaths, we talked about people not wanting to mask, vaxxing, anti-vaxxing, the miracle of vaccines, and at the end of the day, unfortunately, almost 900,000 lives lost. And it wasn't just the print media.
In these times of uncertainty.
During this time of great uncertainty.
During these uncertain times.
During these uncertain times.
In uncertain times.
In uncertain times. Uncertain times.
Unprecedented times.
Unprecedented times.
Unprecedented times.
This unprecedented moment in our history.
I mean, how could you not be told that you're uncertain and it was unprecedented every minute of your life and not believe it was true? But I do think that to navigate uncertainty, sometimes you need to take a step back, slow down, and just think. You may say, well, think about what? I think one of the biggest things that we did during this pandemic was applying a one-size-fits-all conversation to all of COVID. This was never a one-size-fits-all disease, and we knew that. This is a graph from The Economist. It was a calculator that was put out in 2020, right before the vaccines became available. And you can see the risk of both hospitalization and death, hospitalization in red, death in blue. It doesn't hit 1% for death until you hit 60 years old. That's one thing that we really have to think about. And so we spent all this time on wear a mask, but what kind of mask? 6 feet apart, but not outside. And all this energy was spent when we could have focused on the most vulnerable in our community and been able to still move forward. And obviously, I'm a 50-year-old black guy. I probably have some comorbidities. But you can see, even for me, my risk was about 4% of hospitalization. If you give me diabetes, which I don't have, it jumps to almost 24%. Those are the differences in care that we really need to talk about. And if you don't believe The Economist, that's okay. Let's talk about the CDC. Even in 2020, the CDC was very clear about this, right? That compared to 5 to 17-year-olds, people that were 85 and above had an 8,700 time chance of death. And we missed that opportunity to potentially protect some of them. And because of that, we went through these last 2+ years with fear. Fear of the unknown, fear of death, fear of whether you're gonna lose your job, fear of whether you're gonna lose your relationships, right? How many of you had those friends and family members that potentially Thanksgiving didn't go very well because you were arguing over vaxes and vaccines? And so as we kind of move forward, say, well, all right, we've talked about the uncertainty part. Well, why should I be worried today? Well, I think the New York Times did a great job. So they asked some people, and they said, are you worried about getting sick this year in 2022? And you can see already where that uncertainty comes into play. A majority of people that are already boosted are actually more concerned than those that are unvaccinated. Let's divide it by age, right? Because we don't know vaccine, not vaccine, it might bias the pool. And even younger people are more worried about getting sick than older people. Now, one of the things I would ask you is, if you had to choose one thing that probably drives this divide, what do you think it'll be? Politics. You read my slides. And so this could have been a picture of President Trump. It could have triggered you if it was President Biden. But the reality is that political ideology determined how we felt and how we thought about COVID, as you can see behind me. But what's remarkable is that no matter what side of the political divide you sit on, you are wrong about the risk. We massively and majorly underestimate the risk to the oldest and most vulnerable parts of our population, while overestimating the risks to the least vulnerable, like my son, for example. And so we spent all this time worrying about schools and masks, and probably not enough time talking about the elderly and long-term care facilities, nursing homes, congregate facilities, and 80% of the deaths in SARS-CoV-2 have been in people above the age of 70. Let's take a step back. As we deal with uncertainty, it's important, I think, to understand that we are now in evolution. You've heard the term from pandemic to endemic, right? We hear it all the time, and there's a lot of controversy about that, and I think that's okay. But I also think it's important to sort of really look at this. Through the width and breadth of this pandemic, the risk of hospitalization and serious events have changed. And they've changed primarily because of vaccines, absolutely. But it is not just vaccines. We have to acknowledge that, especially with Omicron, we've probably infected 50 to 60% of this country in a 3-month period. Those people also have immunity. And so this is no longer 2020, right? This is no longer for example, your grandma's SARS-CoV-2. This is a very distant COVID. And so in 2020, very different. Some parts of our population had a 10-time risk of death with SARS-CoV-2 compared to influenza. That is no longer the case. In every data set you look at, those that are below 40 have much less risk and potentially almost equal or less to influenza. And that is why this becomes a conversation about evolution. And I think it's critically important to really rein in when we look at that and understand why that's important. 6 years ago, I stood on this stage and I talked to you about being a digital immigrant. And we talked about healthcare information technology. We talked about the devices that you have in your pocket, your phones, and the power that they gave you. The unfortunate thing is that nobody ever knew that a pandemic would turn all of those things on in an instant. Whether it was the Zoom and WebEx culture we have of work from home, whether it was people turning to telemedicine and not having to go to their physicians, we've changed the way we engage fundamentally for the next generation and beyond. Data is gold. Data drives the way that we work. Unfortunately, both our public health departments, here and others, the CDC, and a lot of our broken healthcare system doesn't have that data. They rely on faxes, they rely on manual data entry. You can't make decisions if you're living in 1980 in 2022. And so at the height of our pandemic, November 2020, we had tents outside, our hospitals were bursting at the seams, we're bringing in the DOD, the military, everybody to help our community. We're number 2 in terms of cases per capita around the country. We turned to the alternative care site. And a local organization called Fix was the lifeblood of that care site. Their data and the investment and the work that they had done for the last 10 years prior was suddenly able to turn on. They were able to move 300 patients out of our hospitals into the alternative care site, 500 patients from our community to other communities across this country and across the state, 300 veterans and military into William Beaumont, the brand new medical center. That is the power of data. And almost all of you have seen this before, right? This is what we use in our community to determine where are our cases, where are we going, should we mandate, should we shut down, should we reopen? All that is the power of data. And so let's go back to that first question. You remember the first question? Of course you don't. That first question, What is the biggest risk factor for hospitalization and death in SARS-CoV-2? I gave you a cheat sheet, but somebody. Thank you, it is age. Then the next question becomes, so what is the risk of hospitalization when you get SARS-CoV-2? And I've broken it down by ideology, right? Because we're all political people. We all want to break it down. Okay. So somebody help me out. What's the answer?
Democrat.
Well, no. It's 0 to 50%. What is the risk of hospitalization?
Who's of power?
1 to 5. Now, you may say, well, I knew that. If you knew that, you should have said it. But I think what's more important is think about this. In September of 2021, almost a year after we had widespread access to vaccines, 60% of Americans, irrespective of political class, felt that the risk of hospitalization was 10 times greater than it truly is. That is a failure on our part in terms of communication and in data. And so I'm often asked, what is the biggest thing that you've learned throughout this pandemic? And I think there are a lot of things. For me, the biggest thing has been, it's okay not to have the right answer. But when you communicate openly and communicate honestly. And that pivots me to sort of the closure here. All these things are not easy, and there are multiple modes of communication. Phil Tetlock is a writer that talks about science, psychology, and organizational behavior. And he talks about 3 modes of communication. He talks about being a preacher. And in a preacher, I talk to you because I am right. I have righteous knowledge of what I believe in, and that's how I'm going to communicate to you. When you're a prosecutor, I talk to you as if you are wrong, you are bad. You can already identify the ways you hear the media spin things different times. And then, of course, for the politicians in the room, y'all just say whatever we want to hear because you need votes, right? And that's okay too, but your core beliefs don't change. I truly believe that there's a 4th way, and potentially the best way to deal with these things. And Adam Grant talks about this a lot, and that's thinking like a scientist. I was like, well, what does that mean, thinking like a scientist? It means leading with humility and not with pride, right? Having curiosity, not being based on convictions. And do not let your ideas become your identification, whether political or otherwise. And so as we move forward, it's easier said than done, right? All these things, I mean, if they could be done, anybody would do them, but they're difficult. I think it's important as we sort of figure out where we're going next to understand that worrying is okay. Worrying is a sign of uncertainty. We were worried because at the height of this pandemic, you didn't know whether you're going to have a roof over your head. You didn't know whether you're going to be able to eat food. Some people, unfortunately, didn't know whether they are going to be able to survive being intubated. But to change uncertainty, you need action. To create positive action, you need data. And the best way to get that data, I believe, our call to action as a community is to invest. Invest in what, you might say? Invest in infrastructure. We must invest in public health. Public health will help us not just today, but tomorrow, for my children, for your children, our grandchildren. That is the foundational element of how you protect a community. Invest in data in organizations like Fix that are connecting a very fractured healthcare infrastructure. And invest in education. Not just the education of people like me that are physicians or dentists, but investing in the education of nurses who are truly the lifeblood that hold our healthcare community together. I believe we've been through a lot. I know that we can get through this. My name is Ogechika Alozie, and I'm evolving through uncertainty. Thank you very much.